So welcome everyone. Thank you so much for joining us this evening. As you had heard, we will be recording tonight so we can help others learn in the future about this important topic that we'll be exploring with Dr. Weiss. My name is Leanna Levine-Reisner, and I am the Plant-Powered Metro New York Network Director. Plant-Powered Metro New York empowers people to find better health and overcome chronic disease through whole food plant-based nutrition. We offer evidence-based education, resources, and support to create community and inspire change throughout the New York metro area. We're really glad you've come to learn with us. As I mentioned, please feel free to introduce yourself in the chat box. We really love to meet folks, and in the absence of being in real space with you, try to make the most of these virtual spaces. As a reminder, please do keep your lines muted, and we will be digging into a really important topic, honoring and marking the Breast Cancer Awareness Month, which is during the month of October. Before we get started with Dr. Weiss, I actually wanted to offer some questions to all of you through some polling, just to learn a little bit more about the experiences that you all bring to the table. And so what I'm going to do is I'm going to launch a poll, and you'll see some questions in front of you, and just answer the questions that come there will be 3 questions, and then I'll be able to show you the results afterwards. It's a completely anonymous poll. So here we go. So you'll see the first question is, how has breast cancer impacted you? You can choose any that apply. The second is, if you've ever been treated for breast cancer, to what extent was nutrition part of your treatment or healing protocol? Choose any that apply. And then before tonight's program, how much have you heard about plant-based nutrition in breast cancer prevention and treatment? So please go ahead and fill that out. We're just going to wait a few moments as answers come in, and then we'll take a look at everything. Okay, excellent. So I'm going to be ending the poll in just a few moments. So let's finish up here. I'll give you a 5, 4, 3, 2, 1. Okay, we're going to end the poll. And what I'll do is share the results here. So among you, a third of the folks joining us on the call are breast cancer survivors, and a third have not experienced breast cancer personally, but really are here to learn more. And for many of us, you know, we have some kind of experience that brings us to the table here. Maybe you had cancer treatment, maybe you had a friend or a loved one diagnosed or lost to cancer. And among those who have been treated for breast cancer, it looks like in most cases, folks did not receive nutrition information in their treatment plan, and some sought out additional resources. And then before tonight's program, it looks like a good number of you know a little bit about this topic or something about this topic, but would like to learn more. So thank you all for participating. It really helps us to get a sense of who's in the room and how we can be supportive of you in this very important conversation. And so to kick it over to Dr. Weiss, what I'd like to do is just tell you a little bit about him. He's a member of our medical advisory board and is a dual board certified in internal medicine and lifestyle medicine, and a primary care physician in New Jersey. He is the founder of Ethos Primary Care and assistant professor of clinical medicine at Rutgers, New Jersey Medical School. And he offers an evidence-based food as medicine approach to healing from chronic illness and optimizing wellness. He's the founder of Ethos Farm Project and has been featured in top media, including the New York Times, the New York Post, and Today Show. His primary care practice in New Jersey is located on a 342-acre farm, which you're seeing a picture of right here, which employs conscientious chemical-free farming methods to restore the vitality of the land. So we're going to hear a lot more about that right now. Dr. Weiss, please take it away.
Okay. Thank you so much, Leanna, for that wonderful introduction. The exciting thing I just want to add to that is that we have brought the farm to the middle of New York City now. And I am in New York City doing primary care every Tuesday on 58th Street between Park and Madison. So we start to do that as of Labor Day. So we're very excited to be right in the center of it all. And then the other days we're on the farm. So I'm going to minimize this, I guess. And can I close this, the poll results?
Yes, go ahead. Everybody can close their results so they can just see the screen.
So is that screen looking good to you now of the
Looks
farm?
gorgeous.
Okay, so let me tell you a little bit about this field. So I, I'm a primary care doctor, and I'm a lifestyle medicine board certified doctor. And, as I reached middle age, I began to get frustrated with all of the onslaught of chronic disease that I was seeing. When I was in medical school, there were, as I graduated, New Jersey Medical School, 1 in 11 women were diagnosed with breast cancer in America. Today, it is 1 in 8. And that has occurred just over 30 years, that increased incidence of breast cancer, believe it or not. Chronic disease is rising relentlessly in our country. And I began to realize that this chronic disease, this epidemic, including breast cancer, was due to the food we were eating. So I decided to end my current practice back then and decided to move to this farm. It was a broken down old farm about an hour west of New York City. And it was formerly growing GMO soybean and corn from Monsanto in this field that you see. And what you're looking at is the first crop that we grew. And for those of you who know anything about grains, this is a crop of oats. It's oatmeal. And the reason why I'm showing you this is an example of a food that helps to prevent breast cancer. Now, there are many foods that help to prevent breast cancer. There was a study in the journal Cancer that came out earlier this year that was a meta-analysis of a large number of studies that showed that the soluble fiber in oats and oatmeal, and you can also find this in legumes, but particularly in oatmeal, gave a significant advantage in the prevention of breast cancer for women who ate it on a regular basis. So I'm showing you this picture just not to show you the beauty of oats ripening in early July, just before they're harvested, but to let you know there are things that we can do for the prevention and treatment of breast cancer with food. And, when I see these pink ribbons on packages of cheese or yogurt or dairy products, which we will discuss later, I just want you to know that food is not, even though it has a pink ribbon on it for this Breast Cancer Awareness Month, those foods are not the kinds of foods like oats are that help to prevent and treat breast cancer. In fact, even though it has a pink ribbon on it, a food like that helps to cause breast cancer. So we're going to talk a little bit about this and the scientific basis for all this information I'm giving you. I give this talk yearly on the farm you just saw, in memory of my first cousin, Barbara Dworkin. She was diagnosed 2 years after I graduated. I was a young physician. She was my first cousin, 42 years of age. No one had ever had breast cancer in our family before. She was diagnosed with an aggressive breast cancer and died within 18 months of diagnosis at age 42, and had a farm not too far away from my farm today. So we give this talk in memory of her every month, every year. So in this talk, we're going to learn about breast cancer screening and the controversies over that. We're going to learn about the foods that are beneficial to prevent and treat breast cancer, and the foods to avoid if you want to avoid increasing your breast cancer risk. So one of the first classes you get to in medical school when you're a first year first year medical student, is a class on prevention. So let's go over that for a moment so we can understand what we're dealing with when we say preventing breast cancer. So when I'm talking about preventing breast cancer, I'm talking about the most desirable approach, which is primary prevention. And this not only has to do with breast cancer, but the prevention of any disease that you wish to deal with. So as it applies to breast cancer, if you have primary prevention, you are seeking to avert the breast cancer disease altogether. And I hope those of us who are in the audience tonight who have never had breast cancer, this is our goal for you in giving this talk. So the disease is not present that we know of. We will listen to this talk. We will adopt a diet of whole plant foods and healthfulness, and then significantly lower our risk of getting disease and help to prevent it before it's ever noted. Okay. So that's always the most valuable kind of prevention for any disease. Let's go to secondary prevention. Secondary prevention is what we do today, which is recommended by all the hospitals and the federal government and the American Cancer Society and the Susan B. Komen Foundation, all the breast cancer, organizations. This is the best they have to offer in the prevention of breast cancer, and it is secondary prevention. And what does that mean? Well, that means that you already have the disease, but you're trying to find it when it's at its earliest stage so you can deal with it and save your life. And mammograms and the recommendation for mammograms are an example of a secondary prevention tactic, right? So what we do is we're not trying to prevent the disease as in primary prevention. We're just trying to look for it. So hopefully we can find it when the breast cancer is small, then get a lumpectomy and radiation, and hopefully deal with it before it spreads. Tertiary is the least desirable form of prevention, but it does have its role. In the terms of breast cancer, this would mean, let's say you have stage 4 metastatic breast cancer and you start to have hip pain, and the doctor does a PET scan and finds that you have a metastasis to the neck of your femur. Well, to prevent your femur from fracturing, radiation will be given palliatively, to stave off the inevitable at that bone to prevent the complications of fracture so you can continue walking. That's tertiary prevention. So again, what I aim to do with this talk is to move everyone into the primary prevention stage. And listen, even if you've had breast cancer and you're a survivor, right? You don't want to get breast cancer again, right? A secondary occurrence of it. So it is still primary. Yeah. So, and mammograms are secondary prevention. Here is a mammogram being performed. So let's talk about the most powerful set of data and influential data that has come out in the past generation that has shaped our thinking about that secondary prevention for mammogram screening for breast cancer. So, I'm sorry this has to be, I'm glad I'm getting to meet with you tonight, but I also like to do an interaction with the audience when I give this talk. So here I'll just, talk amongst myself. And, but I usually talk with the audience at this point. And I talk about the fact that 25 or 30 years ago, when I graduated medical school, the figures were 1 in 11 American women got breast cancer. Today, it's 1 in 8. So the question is, that's a significant uptick in the incidence of breast cancer in the United States, what would be the cause of that? You know, is it that we're eating, our diet is worse? Is it that we're exposed to terrible pesticides or carcinogens or heavy metals? Like, what is going on here? And really, what the answer is increased secondary preventive tactics. That's why the incidence of breast cancer has increased. So what do I mean by that? Our mammograms have gotten better, more focused, can see smaller lesions. We've gotten better at reading them. They do MRIs, they do all kinds of things with different biopsies, and there are now breast cancer centers in every major hospital has a breast cancer center. So the screening has become industrialized to the point where we are bound to pick up just more breast cancers that are there because our techniques are much, much more sensitive. So the question is, does that do us any good? The Cochrane 10-year study answered this question. So for every 2,000 women screened with mammography, this is what was found. One life will be saved. So if you take 2,000 women at random from the population and you give everyone a mammogram, one life out of the 2,000 will be saved. If you hadn't given those 2,000 women a mammogram, someone would have died from breast cancer. Okay. However, and a lot of us may see, well, you know, it's worth doing 2,000 mammograms over 2,000 women just to save one of us, one in the 2,000. Okay. If that is your belief, it's also important to know what happens next. So yes, one life will be saved, but for that one life saved, 10 healthy women will become cancer patients who would have never known they had cancer, and they would be treated unnecessarily. Now, I know this sounds a little bit confusing, but let me maybe clarify this. What this means is that we all have cancers in us. After you reach the age of 20, we have cancers that are the size of the tip on a ballpoint pen, and they develop all over us. For example, by the time we reach 50 years old, 50% of us have thyroid cancers. By the time we reach 70, 100% of us have thyroid, tiny little cancer cells in our thyroid, but no one ever finds out about them because we don't really look very well. We know from autopsy studies of 40-year-old women who died in car accidents who never had previously diagnosed breast cancer. If you autopsy them and cut their breasts and examine the tissue inside, 1/3 of all women aged 40 in that study had breast cancer that was very small nest of breast cancer cells. So what I'm trying to say with this is that there are significant numbers of women who have occult breast cancer that is living in the breast, but it will never become known unless you start to look too closely for it. So for every 2,000, 10 of those women were diagnosed, had mastectomies or lumpectomies, radiation, chemo, and became, potentially sick or had suffered those consequences when they wouldn't have otherwise. And lastly, 10% or 200 healthy women who don't have any cancer at all will be given a false alarm. And they will be told when they get their mammogram that, you know what, something doesn't look quite right there. You know what, maybe we better get an ultrasound. You know, that doesn't look right either. Now maybe we better biopsy you. They have to go through a lot of emotional pain, strife, suffering, and anxiety before being told, well, you don't actually have any breast cancer. Okay? So because of these eye-opening data, the federal government's main advisory committee, the U.S. Preventive Services Task Force, reduced their recommendations for getting mammogram screening. So until about a decade ago, the federal government, through the task force, recommended that women get mammograms first as a baseline at age 35, then every 1 to 2 years between age 40 and 50, and then every year from 50 on until you are dead. If you're 100 years old, 105, you were still to get mammograms. Because of this data, the task force decided that it was necessary to reduce the recommendations. And so today, we never, according to their recommendations, get mammograms for the average woman age less than 50. So it's between 50 to 74, and that's every 2 years you should get them. So some of you might say, well, so, but I'm getting more mammograms than that. For example, the American Cancer Society recommends a little more than that. They recommend a yearly evaluation starting at 40. They did. They stopped that. Now they moved it up to the age of 45. And then every other year starting at age 55, but they don't have necessarily any stop point as you get older.
No, I'm not watching it.
Here's the other consideration that I often review with my patients, especially those of us who are whole food, plant-based women. You have to remember that these recommendations were made for the average American woman who has a relatively high risk of getting breast cancer. But we know that with lifestyle, adherence to a good lifestyle, including a diet of whole plant foods, that your risk of getting breast cancer is low. So my approach with women like this is to say, you have to remember, if you have a much lower risk than the average American woman for which these recommendations were made, if you get, for every extra mammogram you get, you are actually increasing your chance of getting breast cancer just from the radiation dose of the mammogram. Because remember, the radiation given from a mammogram is not a small dosage of radiation. And it is considered to initiate cancer growth. And I think that's one of the reasons why the major authorities like the American Cancer Society and U.S. Preventive Services Task Force decided in the first place to reduce the frequency of breast cancer mammogram screening.
Great. Dr. Weiss, we actually have 2 questions specifically on the subject of mammography and screening, and I want to just pause if we could right now. Yes. Before we go into the food conversation. One question was, is it reasonable to do the annual breast check that's not including mammography? Is that are other measures for checking the breasts good things to do?
Yeah, that has also gone by the wayside. When I was in medical school, I was taught to examine, medical students were taught to examine a woman's breast in an annual physical exam, and then that the woman should also do their annual, monthly breast exam in the shower. I remember there were little hanging cards that showed you how to do it, shower. All of those have gone by the wayside. They have not been thought to be helpful in the early detection of breast cancer.
Gotcha. And is there a difference here when you talk about the difference between like a screening mammogram versus a diagnostic mammogram?
Well, it's the same thing.
Okay.
Yeah. Diagnostic just means to diagnose or find breast cancer. So, but screening means that the word screening means that you're taking a population which is not known to have the cancer, but you're putting them through a funnel, the whole population, that 2,000 women sample that I showed you on the previous screens, and you screen them with these. Each one gets a mammogram to distill out or find the ones who have cancer.
Mm-hmm.
You're screening, like you're passing, like you're in a stream, panning for gold, right? And you pick up the sediment or the rocks and the pebbles in the stream, and you screen it, and the sand falls out, and you're left with the gold nuggets. So you're
Right.
screening to find your endpoint.
And so you're saying even for those who might have a family history or sort of an increased risk from other things.
Well, this was for the average woman.
Ah, okay.
If there are extenuating circumstances, then each patient has to be taken individually. This is for the average woman. Certainly if you're known to have BRCA, BRCA mutation, then other considerations have to be made.
Okay, gotcha. There are other questions related to sort of different types of tools that are out there, the MRIs or ultrasounds versus mammograms as ways of screening without that radiation. Are these things that people should consider?
Well, so in younger women with very dense breasts, mammograms are not as sensitive. So oftentimes, and if lesions are seen to be cystic, ultrasounds can help. In the very dense breasts, ultrasounds are also used to help define and give contrast in visualizing the tissue of the breast. So that's what ultrasounds are used for, but they're not the primary tool. It's mammograms to diagnose breast cancer, even to this day.
Mm-hmm.
As far as MRIs are concerned, MRIs are, it's like opening Pandora's box, because they're so powerful that you may start seeing things that you don't want to see there. Like, for example, with an MRI, you will find those. Remember, I told you that third of all women who have stuff hiding there that is not clinically significant, but you'll find it, and then everyone will have breast cancer. They're too powerful. And they may identify spots that are not breast cancer, which then trigger investigation. So at this time, we don't use mammograms for the average woman to investigate for breast cancer.
Mm-hmm. And will the MRIs also expose people to more radiation?
No, MRIs don't have radiation,
Mm-hmm.
but CAT scans do.
Okay.
CAT scans do, and CAT scans increase your lifetime chance of getting breast cancer, cancers in general, depending on what body part you radiate, but not MRIs.
Okay. And one last question on this subject was just about the 3D mammogram. Is that just another variation on the same theme, or what else?
There's still not there are all different kinds of bells and whistles, and people do thermograms and other kinds of things. The standard diagnostic tool is still the old-fashioned mammogram.
Okay, great. Let's move on then. Thank you.
Okay. So now we're going to talk about my favorite thing, which is the primary prevention of breast cancer, because we're going to talk about foods that prevent it. And then we're also going to talk about these same foods in their ability to treat breast cancer if you've already been diagnosed. Okay. Can I ask a question, Leanna, to see if anyone can?
Sure thing. Go ahead.
So I want to know from the audience if anyone knows what these beautiful blue flowers are. No, this is not at our farm. We're not growing this.
Feel free to unmute if you do know. I think you got a stumper.
Are they nasturtiums?
Nope.
No.
But there's some of the truest blue flowers. True blue flowers are kind of unusual. There's some of the bluest flowers you will ever see.
We got a guess of poppies or nightshade.
Well, there's a reason why I'm telling you this. I'm showing you these plants because I'm a botanist and farmer, and this field grows. This will yield perhaps the single most powerful food that prevents and treats breast cancer.
Oh, can I guess?
Yes.
Is it possibly broccoli flowers?
Nope.
I don't know what broccoli
But
looks
that
like.
is pretty powerful. I would say that's a second place.
Okay, good. Now I feel justified.
This, my dear people, this is flax.
Amazing.
This is flax. We get flax seeds. These flowers then turn into these gorgeous, gorgeous flowers. Give rise, months later to these very unassuming little brown seeds. Can you believe it? And this is one of the first plants that we have evidence of archaeologically that was domesticated by mankind. We have evidence of this from caves in Northern Europe from about 20,000 years ago. And then we also know that even in ancient cultures, this was an important and medicinal food. It is found, the flax seeds themselves were known to be intentionally grown and produced in ancient Egypt. They are found in tombs, in Egyptian tombs. And even Mahatma Gandhi was known for this quote, "Wherever flaxseed becomes a regular food item among the people, there will be better health." For thousands of years, Indians have consumed flax seeds. So what is it that is so magnificent about these flax seeds? Well, there's a lot, but for the purposes of what we're talking about now, we're going to talk about lignans. I don't know if you've ever heard, I'm sure probably you have heard of the term phytoestrogens. Phyto meaning plants, estrogens meaning estrogen, the female hormone. Well, lignans are phytoestrogens. And a lot of us are familiar with the fact that soy has phytoestrogens. And many oncologists are familiar with this. And much to my bewilderment, when we do see breast cancer patients, they tell us that they ask their oncologist, can they eat soy? And the oncologists say no, because it's rife with phytoestrogens, which is true. But as you're going to find out later, these phytoestrogens help to prevent and increase survival from breast cancer, not cause it. Just because they have the term estrogen, it doesn't mean that they're the kind of estrogen that's inside of us, inside of a woman, that spurs on breast cancer. So we'll talk about soy in a little bit because that's very powerful, like flax. But I just want you to know, just as soy is probably the most concentrated form of phytoestrogens from the Eastern world, from Asia, because that's not a Western food. Flax seeds is from the Western world. And that is a very high source of phytoestrogens in the form of these lignans. So let's find out about these lignans. Okay. And by the way, so here's a chart that shows you the content by food of these lignans. And look at that flaxseed pulling out there. There's nothing that even comes close. There are 85 milligrams of lignans per 1 ounce serving of flax seeds. The next runner-up is sesame seeds, which is, just a fraction of that. And then even these amazing things that we, right, is so powerful, like kale and broccoli. Look, it's almost nothing compared to flaxseed. But, I just want to remind you, that doesn't mean that you shouldn't eat kale and broccoli. I'm just talking about one focused area. There are other reasons why kale and broccoli could help you, and we'll get to that in a moment. Okay, so here's also something that's very interesting. An aside. Well, I'll tell you in a moment. I just wanted to let you know that I don't know if those of us who are maybe older, like in my category, or 50s or 60s, if you remember that like in the 70s or 80s, there was a cluster of breast cancer incidents found in Long Island. So the Long Island Breast Cancer Study Project was founded. And we have a lot of data coming from there. And we found out from looking at what women were consuming in that population of Long Island, the breast cancer study, that the average woman consumed about 6.3 milligrams of lignans a day. Okay, that amount of lignans is equal to about the amount of lignans in 1 teaspoon of ground flaxseed. So let's see what 1 teaspoon, if you ate 1 teaspoon of ground flaxseed, let's see what it can do. Well, in this National Cancer Institute study, that 1 teaspoon a day was found to significantly lower a very ominous marker, Ki67, which indicates aggressive breast cancer cells, the cells that will likely metastasize and spread. It was just that 1 teaspoon a day was found to significantly lower these markers when they biopsied it in young women who are at high risk for breast cancer. And remember what we said, maybe those women had BRCA, right? Maybe they had their mother or relatives in their family had, breast cancer, or maybe they had other kinds of ominous changes in their breast. So 1 teaspoon per day. So remember what I said in that Long Island study, the women were getting the equivalent of 1 teaspoon just eating in their regular diets. And you have to remember, these women most likely were not eating any flaxseed at all. They were just getting 6 milligrams just in all the foods they were eating. So this 1 teaspoon basically doubled the amount of, if you took this in the study, would double the amount of lignans over the women in that breast cancer study. And of course, in this famous Ontario, this Canada study, Women's Diet and Health study, it was found that consumptions of flaxseed is associated with a significant 20 to 30% reduction in your risk of getting breast cancer. How about if you have already had breast cancer? Can flax seeds help you? Yes. In the Western New York Exposures and Breast Cancer Study, and by the way, all of these are landmark breast cancer studies, we found out that there were definite survival improvements in postmenopausal breast cancer women's in the quartile that had the higher, or the segment that had the higher lignin intake, right? So if you took that teaspoon of flaxseed, you were getting those extra lignins, you were more likely to survive. And then just in 5 weeks, in postmenopausal breast cancer women who ate everyday flax seeds, they had, again, significant reductions in these ominous tumor markers that showed cancer cells would proliferate and spread. So this is why I recommend to my patients that they eat 2 tablespoons of ground flax seeds daily. So remember what we said in that study that was beneficial, basically had you eating a teaspoon per day. So this would turn out to be 6 teaspoons per day. So a lot more. So Dr. Weiss, why can't I eat 5 tablespoons? Why can't I eat like 3 times this? And the reason why we're reluctant to do that is because, as in most things in life, there is such thing as too much of a good thing. We do know that flax seeds do have cyanide in them. You know, it's cyanide, like the poison. And I think that 2 tablespoons, for my comfort, is the maximal level of intake that you could eat and still stay safely within those boundaries and not get into trouble from cyanide. So that's what my recommendation is. And oh yeah, I want to tell you one other comment about flaxseed. So you know what's amazing about flaxseed? This is a little secret a lot of people don't know. You know, we've been talking about lignans, which are these phytoestrogens, right? Which do help us. and just an aside, you know, we found out that they are called phytoestrogens, but they don't act like female estrogens. They act like estrogens and they bind to estrogen receptors, but they're different kinds of estrogen receptors in our bodies. And the receptors that these phytoestrogens bind to, not only do they not increase your cancer incidence, but they help to improve outcomes. So that's one thing I wanted to tell you. The second thing I wanted to tell you is that, believe it or not, I know I kind of maybe pulled the wool over your eyes, but these flax seeds, they have no lignans at all. What they really have is lignan precursors. It's like a starting material for lignans. I didn't want to get into this with you, but now I am, because now that you're such experts on lignans, it's important to know that you need a good gut microbiome and great bacteria in your gut to break down the lignan precursors in the flax seeds, and then those bacteria will create the lignans that are absorbed into your bloodstream and help prevent breast cancer and help treat it. So so protect your microbiome, gut microbiome, and your entire microbiome of your body with your life. This is one of the most important things that I always try to stress to my patients. Things like taking antibiotics frequently, like azithromycin or Z-Pax, or antibiotics for urine infections. They've been found to destroy the bacteria that create these stable lignans from lignan precursors in flaxseed. Okay,
Great.
let's go on. I'm
Sure.
sorry.
Just one quick question related to the flaxseed that people brought up. For some people, it has sort of a laxative effect. And for those who have some kind of challenge eating flax, would you say that they can avoid it and focus on other foods that are equally healthy, or just keep the flax and try to titrate it down to the right level for you?
Well, you know, first of all, you must know that if anyone's ever been to my waiting room, the main piece of artwork is this enormous poster of those blue flowers. It's a botanical poster from the mid-20th century of the flax flower. So that's how important it is for me. I give it to every one of my patients. I've treated probably about 500,000 patients. I've never seen anyone who couldn't tolerate it. So I have two suggestions. If you think you can't tolerate it, as you said, Leanna, perhaps, you know, it's better to have 1 teaspoon a day or 3 teaspoons a day instead of, you know, 6 teaspoons rather than nothing. So you could titrate it down. However, what I would suggest is you may have to, perhaps there are other ways you could work on your gut microbiome, and maybe with other dietary components, so that you have a more solid stool, so you don't have that problem. I think flax is so important, and not just for breast cancer. It's important for men. 3 things I can think of off the bat. It's important for men because it's critical for prostate health, helps to prevent enlarged prostates. It most likely helps to fight prostate cancer. And of course, it's very important to help to increase the long chain omega-3 fatty acids in our brain that help to retain our memory, so we don't lower our dementia risk as we age. So those are 3 things right there that I think are important. It's not all about breast cancer, but I try to get my patients to eat them every day.
Great. We can move on.
Move on? Okay. So remember we were talking earlier about the phytoestrogens. So just like lignans is the phytoestrogen in the flax, the genistein, that's the name of the the phytoestrogen, the plant molecule, that's very specific to soy. And that is the phytoestrogen. So this is a meta-analysis. It's a combination of three major studies that were, the largest was published in JAMA, the Journal of the American Medical Association, which almost all doctors read. And it just goes to show you, I'll go over the details in a second, but it goes to show you that what powerful positive effect having soy regularly can have on women who've already been diagnosed with breast cancer, and when we use soy as treatment, a form of treatment. So let's look at this chart. You'll see that along the horizontal axis, it goes from 0 to 60. That's the number of months of life that we give to breast cancer patients. You know, the oncologist will say, hey, if you make it, you're diagnosed at 0, and then the clock starts ticking, we treat you. If you make it to 60 months or 5 years, right, and you have no sign of breast cancer anymore, you're cured. We give you a cure stamp. You're a survivor, it's not coming back, right? So that's why this chart runs for 5 years or 60 months. And then on the vertical axis, you see the percent of patients start surviving over those 5 years. We start off with 100% of women, and these were all comers, women with breast cancer, little breast cancers, big breast cancers, aggressive ones, mild ones, women who had all kinds of treatments, lumpectomies, mastectomies, only chemo, no chemo, all women. And what, over thousands of women, what they found were that the women who had the least amount of soy, which was basically 0, had basically like a 50% chance of surviving at the end of the 5 years. And if the women with the most amount of soy had in the range of just over 80% chance of surviving. That's like a 30% improvement, right? In your chances of survival, just if you added this one food to your diet every day. Now, how much did they have to add when it says with soy? Those women who did well at the top, the green curve, it was equivalent to just drinking a glass of soy milk every day. It was the amount of genistein in 1 glass of soy milk. That's it. That's all you have to do. And mind you, when I show you the effects, the takeouts and effects of these individual nutrients or foods, it doesn't tell you what else the women were doing, right? The study was controlled for that. Like, for example, you could have eaten cheeseburgers or smoked cigarettes along with your soy, and you would still get that benefit, right? So that 30% improvement is just due to the soy. Can you imagine if you didn't smoke cigarettes, you ate kale and you ate flaxseed and did other things? I'm assuming you'd have even a more fabulous survival rate. So why does this work? Well, this fascinates me. And that's why I'm telling you this story, because I like to liven up my boring lectures. So we've all heard about BRCA, right? The BRCA gene. This is the, believe it or not, so just so you understand, BRCA is a good thing to have. It is a breast cancer suppressor gene. It is a normal gene that we have in our DNA. And what happens is, all through your life, this breast cancer suppressing gene called BRCA, when a breast cancer cell or an abnormal cancer cell starts to arise, it suppresses it and tries to kill it. And what happened with Angelina Jolie and other well-known people who had BRCA and people you know, is that this gene was mutated. It was dysfunctional, and it changed. And what we have found out now, if any of you know about the story of epigenetics, was that we used to think from the 1950s that your genes, you inherited genes from your parents and some bad genes, good genes, whatever. And that's what you got. You ended up with these genes. If you had a BRCA mutation, your mother had it, you're getting it. We understand that that's not really the way it works now, and that our genetics, the expression of our genes and what happens to us is more powerfully controlled by epigenetics, molecules that hop on top of our DNA and our genes. And these molecules can cause mutations and poor outcomes from these genes. So we think the way soy works now is that the genistein specifically is that it goes to our BRCA genes when you eat the genistein, and if it finds things like pesticides, fungicides, carcinogenic molecules that have hopped on top of our BRCA gene and is straitjacketing it so the BRCA can't operate, the genistein cuts that straitjacket and releases this external epigenetic molecule. And then the BRCA comes to life and starts increasing the suppression of your breast cancer and starts fighting for you. And that's why we think that if you just have a half a cup of soybeans per day or drink a cup of soy milk every day, that you will have this improved survival too, okay? And by the way, I say a cup of soy milk daily because, you know, it's readily available. Always try to go for the whole plant food, right? But if you can't get the whole soybean or edamame or the dried beans, you know, have the cup of soy milk.
Mm-hmm.
Okay, any questions regarding that?
Yeah, Dr. Weiss, there was a question. Why is it that doctors are still telling people who have breast cancer or who have a higher risk of cancer to reduce their soy consumption, given what you've just shared with us?
Because they have not been educated in nutrition. If you go into Sloan Kettering, into the cafeteria, it's a cancer hospital. Do they serve hot dogs or bacon? Do they serve dairy products, which cause breast cancer and colon cancer and meat and eggs? I'm sure you'll find it there. I think the doctors don't recommend it because they're ignorant about the nutrition education. And then, of course, behind that, on the institutional level, there are all kinds of other drivers, including moneyed interests, right? Which are behind many decisions.
Gotcha. And there was another question related to genetic modification of soy. Do you recommend that people choose non-GMO soy products?
Absolutely.
Okay.
You should always choose food. So there are 3 levels of plant foods, just so we can go over this. Of course, plants are so powerful. See that brilliant red color? These are our cherry tomatoes that we grow on the farm. That red is lycopene. That pigment is called lycopene. So, look, this study shows, that lycopene is the most powerful kind of, lycopene is called a carotenoid or vitamin A substance in preventing, reducing breast cancer risk, especially in the most difficult to treat breast cancer, which is the hormone negative breast cancers, right? Which are not dependent on estrogen. So let me just go back to that. So look, there are 3 categories that I look at. Let's say you went to this lecture and you have a choice of not eating these tomatoes or eating them. And all you're faced with is you have conventional pesticide sprayed tomatoes or genetically modified whatever, but they're red and they have lycopene. Okay, get them, eat them. But I wouldn't want to, if I could control it, serve myself a side of poison with these wonderful molecules. And that's why, from a personal perspective, you should try to get your food without genetic modification, without pesticides, because you're working so hard, right, to eat so well. why add poison to your food? I mean, the chemicals that are used with genetically modified soy are horrendous. They are, remember we talked about epigenetics. They use a lot of chemical molecules which cause the problems in epigenetic transformation and mutation of DNA. So if you're working so hard, my advice to you is try to eat foods that don't have pesticides and poisons. The highest level you could go is regenerative. You can grow it yourself. You can find certified organic from a farmer you know, as long as you know that farmer is not applying pesticides and chemicals. So yeah, so don't, and more specifically as it pertains to the soy, assume that if it doesn't say organic, that it probably is genetically modified. So try to get organic soy. Okay, so we talked about tomatoes and lycopene, this beautiful red pigment is the lycopene you're looking at, and it's particularly helpful in reducing breast cancer risks, especially in the hormone-negative breast cancer patients. And that's why I recommend eating a daily dose of cooked tomatoes every day, and they're delicious, of course. Why do I say cooked? Because in the raw tomato versus a heavily cooked tomato, when I say heavily cooked, I mean like simmered for hours, you increase the availability of that lycopene by tenfold over eating it raw, the tomato raw. And that's why it's always important to remember that not all foods are most beneficial raw. Right, Leanna? I think we teach in plant-powered Metro New York, you should enjoy a wide variety of whole plant foods.
Right.
Some of them cooked, some of them raw. You need to participate in all kinds of cooking methods because you get different benefits from some plants cooked, some raw. So you mix it up a little bit. And why do I say eat it with some seeds or nuts? Like, for example, the flaxseed you can eat this with. It's because lycopene, remember I told you, is a vitamin A derivative. It's a carotenoid. And the vitamins A, D, E, K, ADEK, A-D-E-K, are fat-soluble vitamins. When we eat these vitamins, like a carotenoid, like lycopene, vitamin A, in the presence of a fat, it's very beautifully absorbed twofold into our bloodstream. And you can get 2 times the bang for your buck just by eating it with a seed, okay? Let's talk about mushrooms, okay? So mushrooms contain the substance which is called aromatase inhibitors. And if any of you have ever heard of these drugs, they are given to breast cancer patients as treatment in the form of Aromatase is the brand name for this drug, and it was found in mushrooms. And the amazing thing about aromatase inhibitors is what they do is they prevent cholesterol from being manufactured in your body into estrogen. So it's sort of like an estrogen blocking mechanism because it not estrogen blocking, but it cuts estrogen in your body because the starting material for estrogen, which is cholesterol, is disabled by this aromatase inhibitor. And of course, the original source is the mushroom. Okay, of course, in the lab, we know this, that these mushrooms are very powerful in this aromatase activity. Let me close this. Okay, and greater mushroom intake was related to lower risk of breast cancer in premenopausal women. And that's why we recommend that you should have some mushrooms every day. So what kind of mushrooms? Well, believe it or not, they tested a lot of different mushrooms for their aromatase activity and the inhibiting activity. And they found that the cheapest ones, the most common ones you can get, not the fancy ones like shiitakes or lion's mane or all these things, the cheap white button mushrooms, the medium to larger ones, not the small ones, created the most aromatase inhibitors. So I say, have half a cup every day, 5 large cooked mushrooms daily. Why do I say cooked? Because this kind of mushroom in this family, the white mushroom, and also the same family includes the portobello mushroom, the cremini mushroom. This family comes from the genus Agaricus. And this family has a poisonous, actually cancer-causing substance, believe it or not, which is called agaritine. And so we know that that the raw versions of all these mushrooms have this agaritine in it. It's a potent cancer-causing agent. And we haven't figured the whole thing out yet, but we know that if you cook it, that heat helps to destroy this
I have to eat.
agaritine. So you should cook them well. I like to broil mine on the top shelf. I just put them on a tray and put it on the oven on broil, put it near the top. Oh, they'll be done in 8 minutes, delicious, and they're really, really soft and juicy. So that's the story with mushrooms. Okay, so Leanna brought up broccoli before, so now we're going to have to talk about the cruciferous vegetables and isothiocyanates. What are isothiocyanates? Well, if you notice, I've given you each healing food, and I've told you the compound which we've done research on, which we know is very powerful. So I know you know what isothiocyanates is, because if you've ever cooked broccoli or Brussels sprouts or cabbage, or you've walked into someone's house where it's cooking, you know it immediately, don't you? Right? So, it smells like rotten eggs when you walk in, like a sulfurous kind of smell. That sulfur is thio means sulfur. It's that molecule, isothiocyanate, being liberated into the air. And that is the molecule which we know is a major cancer fighter. And the major one type of this isothiocyanate, which is called sulforaphane, which is found in broccoli, has been shown to arrest. It just stops the growth of human breast cancer cells. That's when we first found that in the laboratory. In real life, what does this translate into? One of the largest and most respected living, the Women's Healthy Eating and Living study on breast cancer patients, as you can see, had over 3,000 breast cancer patients. It was a lifestyle intervention study, and they showed that if you just ate 5 servings of fruit and vegetables per day, and Leanna, we know that we can do better than that, right?
Oh, yeah.
I mean, like the USDA tells you to eat that, but that's all we eat, right? We eat much more than that. But even just a measly 5 servings, and they were small. And if you just walked, you didn't have to run. You didn't have to go to the gym just for 30 minutes. If you did all of this 6 days per week, you could cut your risk of dying in half once you were diagnosed with the breast cancer. And get this, okay? If just one of those measly servings was a cruciferous vegetable like broccoli or kale or Brussels sprouts, you could then cut your risk of death in half again if you just ensured one of those 6 was one of these cruciferous vegetables. So let's just go over to make sure we understand what these cruciferous vegetables are And can we ask our audience to give us all the cruciferous vegetables to make sure we don't miss any, Leanna?
Sure thing.
So I started you off with we talked about the broccoli. So don't cheat. Don't give me broccoli again. We know kale, Brussels sprouts, we said. Give us all the other cruciferous vegetables. Maybe you can read them.
Yeah, we've got cabbage, cauliflower, Brussels sprouts. Keep them coming. Yes, cabbage of many colors.
Yes, my favorite is red.
Ours too. Arugula.
Yes.
Our
People
radish
forget about arugula. Yeah.
radishes.
Yes.
Bok
People
choy.
forget about. Yes.
All right, we got a
Come
good
on,
group
yeah,
here.
hot audience.
Mustard greens. How about that?
Yeah. Oh, mustard greens are some of the most powerful. That spicy, that difficult to eat stuff. When you know something, the more difficult it is to eat, the more of these molecules it has in it. Yeah.
Chard was the last we've got here.
No, chard is in the beet family. Come on, there's a lot.
Chinese broccoli.
Yes. And what else? What else do we have in that broccoli, which is very related to broccoli? Chinese broccoli, I like that better than broccoli. I love Chinese broccoli. What about broccoli rabe?
Broccoli rabe, broccolini.
Broccolini. What about turnips?
Nice.
Right? What about kohlrabi?
Oh, kohlrabi. That's a good one.
And then, what about daikon? Right? What about, how about if you walk into the Chinatown and you go past the Asian markets, you see these bewildering piles of green leafy vegetables you've never seen before. Those are the Asian greens, like tatsoi and pak choy. They're all kinds of things that we're not even familiar with.
Right. How about watercress?
Yes.
Yeah.
Watercress is another one.
Great, Mare. And rutabaga?
Yes.
And our collard greens also?
Yes.
That's my personal favorite.
That is mine too, because they make great wraps, right?
Absolutely.
You don't need bread. You just make your wrap. You don't need a tortilla. You just wrap it up and it's great. And then, there's one that you may look at if you ever go to Union Square Farmers Market, or if you're in Brooklyn, you go to your farmers market. We grow it on the farm. It's called yakatana. It's from Japan, and it means, yakatana means good for you. And it is a cruciferous, very delicious tasting vegetable, a leafy green, because it's very mild, but it does very well during the summer heat. So we like to even use it as a salad green. Yokata-na. Y-O-K-A-T-A is the first word. The second word is N-A, na. And you can ask if you have a nice farmer at your farmer's market. Ask them if they have it. A lot of them do. Or you can ask them to plant it for you next year.
Amazing. And tell us why raw cruciferous vegetables overcooked?
Okay. Well, the reason why is it has to do with the sulforaphane, okay? These isothiocyanate molecules, which are so valuable. Guess what? If you rip open, after I told you all of this, you get yourself some frozen chopped kale from Whole Foods, or buy some frozen broccoli, you eat it, it will do you no good. It will do you no good, because that vegetable was heated before it was packaged. If you take a raw broccoli head and you cut it up, or a cauliflower, we said cauliflower, right? Cruciferous. And if you cook it and then try to eat it, you will get none of this benefit. And the reason why is, in order to activate this isothiocyanate, sulforaphane, you need a special catalyst molecule, which is called myrosinase. And the myrosinase is very heat sensitive. It's destroyed by heat. So you will never get the end product, the stuff that you want to prevent the breast cancer. So, and other cancers, by the way. So for that reason, what I say is you can either eat your cooked, you can cook your kale or your cauliflower, your broccoli, and at the same time you're doing it, take a raw floret, or take a raw piece of collard or a raw kale and chew it carefully and swallow it and put it in your stomach at the same time. You'll be introducing that myrosinase catalyst, and then it will liberate all of that sulforaphane in the cooked stuff that you ate. Do you understand? Am I being clear?
Sure.
The other thing that you could possibly do is crushing. If you chop finely these vegetables when they're raw and you let them be for like a half hour and then you cook them, you'll also get that, you'll also liberate, the crushing action also liberates that catalyst that makes the sulforaphane. But I think it's just easier just to take, like and whenever I cook kale, if I eat a cooked kale or steamed kale or wilted kale, or I eat cooked broccoli, I'll take like a radish, a red radish, pop it in my mouth, chew it up, and then eat my broccoli. So I'm introducing the catalyst to get this anti-cancer benefit. Got it?
Excellent. Yeah. I want to just note time for everybody. We are going past the 9:15 end time that we had publicized before. We'll probably take it to 9:30 and just make sure we get to questions.
So I can rush it up, I guess, at this point. I know it's getting late. If you wish.
I would love to keep going, but I want to be to respect everybody's time here.
Okay. So let's go quickly through beets and bile acid. These are the beautiful beets we grow on our farm. Beets come in different colors, but just to go through this quickly. So what is special about beets? Well, bile acids, which are detergents that you make in your liver and are excreted into your intestine through the gallbladder, break up fats. They're like detergents that are very necessary. And that's all well and good. But when these detergents, bile acids, get down to your colon, there are bad bacteria down there that convert them into they're called secondary bile acids. And those are very, very mutagenic. They make your DNA mutate into cancer cells. So, and unfortunately, what happens is these secondary bile acids are readily absorbed back into your blood through the colon wall. And guess what loves to concentrate them? Breast cancer cells. They love them. They use them like fertilizer. These cancer initiating bile acids. So here you can see that they are so concentrated in breast tissue, 100, just in breast tissue alone, 100 times greater than the concentration in the blood. And then when we look at newly diagnosed women with breast cancer, these levels in the blood are 50% higher in women with breast cancer than without breast cancer. So what I'm trying to tell you is, you don't want these bad bile acids. You want to try to prevent them from being absorbed back through your intestinal wall into your blood. And beets do that the best. Out of any food on the planet Earth, beets are a substrate that binds to these bile acids and prevent them from going in and then being absorbed by the breast and causing breast cancer. Second place was okra. Who'd figure, right? Okra, what's it good for? It's good for binding bile acids. And king kale only comes in third place. And just to tell you that steamed or boiled doubles all of these vegetables' capacity to bind bile acid. Another example that if you eat cooked kale, it's more powerful at binding bile acids. Cooked beets, twice as powerful than if you grate them raw. Okay, that's why I tell my patients to eat a daily dose of steamed beets. Okay, foods to avoid and why. So when you go to the oncologist, or if you go to the American Cancer Society, they consider this to be healthy foods, right? Look at this. You have wild salmon. You have Greek yogurt, organic. You have a chicken breast, organic chicken breast made without the skin, free range, right? Just sauteed, no butter, maybe a little wine. They all cause breast cancer. FIP, which is one of the most powerful heterocyclic amines, it's a cooked meat carcinogen. We found this out in the 70s when we found out that putting flesh, animal flesh like hamburgers or beef on hot metal grills caused this cooked meat cancer-causing stuff. It's also in cigarette smoke. Believe it or not, it is highest in fish, believe it or not, of all these animal fleshes. And when these animal fleshes, they're not there originally in the food itself. It's only when they hit hot metal surfaces. So in any event, it's important to avoid cooking animal foods to develop these cancer-causing agents. And here we see what happens when a cancer cell is exposed to FIP, what happens to human breast cells, doubling until it causes malignant tumor. No, wine is not good for you, okay? Wine, this is a major study that was from the Nurses' Health Study, one of the largest women's studies, I think the largest maybe ever performed in the world, printed in the JAMA, the Journal of the American Medical Association, found that even drinking 3 glasses of wine a week increased your chance of getting breast cancer. And yes, eating 2 eggs a day does increase your chance of getting breast cancer. If you eat 2 eggs a day, you're eating this amount of cholesterol. See this? And this is the breast cancer risk curve. See where it starts to take off? Right here. 2 eggs a day. And I'm not talking about all the other animal foods that contain cholesterol. Plants contain no cholesterol. Eat a diet of whole plant foods. Let's talk about all the terrible chemicals that are in our foods and where they concentrate. They don't concentrate in plants. These industrial perfluorochemicals, meat and fish, PCBs, these are all powerful, powerful cancer-causing agents. PCBs, DDTs, heavy metals, dioxins, heterocyclic. Look, fish is #1. And then, of course, all the other animal foods. So, you know, it's not all gloom and doom. And the reason why I like ending with this is because I like people to know who've had breast cancer that there is an opportunity. And you can see it with this wonderful woman to overcome your problem.
I had been a runner for 14 years, in fact, a marathoner. 47 years old, at the top of my game.
In 1982, Ruth Heydrich's running career came to a sudden stop when she was diagnosed with breast cancer. After a mastectomy, her doctors recommended chemotherapy and radiation to treat the cancer that had by then spread to her lungs and bones. Ruth decided to visit Dr. John McDougall instead.
And I said, Ruth, I've spent my residency collecting information on diet and breast cancer. It's all in these files right here. Sit in my office and read through it and see what you think.
He said, these are the studies that show what I'm trying to prove is that diet can reverse breast cancer.
And she read it, and she comes out and she says, okay, I've changed my diet. She changed her diet.
So he showed me how to eat, no added oils, lots of fruits and vegetables, whole grains.
Ruth then started training for the Ironman Triathlon in Hawaii, which combines running a marathon with long-distance biking and swimming.
I became obsessed. Kept up the running, of course, never stopped, and then added swimming, biking, and for good measure, lifted weights. And people were saying, "You're crazy. You're a cancer patient. You should be resting." Doctors told me this. I felt so good. I felt fit. I wanted to maintain that level of fitness. And I felt sure that if I had a healthy body and I was putting the right food into it, that I could beat this cancer.
At the Ironman Triathlon, Ruth won a gold medal in her age group.
Stuck with the diet, found out my arthritis disappeared, my constipation disappeared, my dandruff disappeared. No sign of depression, which you might expect with a cancer diagnosis. I felt renewed, invigorated, and out to show that diet is so much more important than anybody ever thought.
Other women get over breast cancer, colon cancer, prostate cancer. There are people who have had metastatic prostate cancer all over the body who have gone through what we call spontaneous remission. In other words, they've been cured. And it's not the end of the world when you get this diagnosis. Some people get over it. Ruth did.
So I'm still racing, still daily training. Now, how many people in their 70s are doing triathlons? Not very many. So that gives hope for all of us as we age, that not only will you stay healthy and beat the degenerative diseases that most people get, but you can start collecting medals.
So with that hopeful note, and just wanted to let you know, I spoke to Ruth a couple of months ago. She's in her 80s now, still running and leading in Hawaii, where she lives, leads these wonderful plant-based whole foods education seminars, and she keeps going. So, you know, it is possible. Breast cancer can be overcome, and the best way and chance of doing that is with whole plant foods and lifestyle change. If any of you are interested in finding out more about this, I'll just give you my the contact information. We have a wonderful Instagram page which has pictures of the farm and wonderful posts that let you know what we're up to on the farm. We have a wonderful Facebook page too. It's at Ethos Health. And then of course our website is ethoshealth.org. As I said, I am a working primary care doctor. I see patients every day and take care of them. Lecturing, as you can probably tell, is not my main profession. It is taking care of patients. And so I love to do that. And I'm now in New York City and New Jersey. And anyone who wishes to make an appointment can do that by visiting this website and giving us a call.
Thanks so much, Dr. Weiss. This is really excellent. And I love how your focus on all of these powerful foods that can really help our bodies in the fighting against cancer in the first place, and then hopefully also helping those who have cancer to reduce the chances of its severity. So important. And I know we're well past time now. What I would like to do, given the interest and the number of questions that have come in, is just to take 4 questions right now. And feel free to hop off if you need to, folks, because the time is late. I'm going to take 4 questions, and some of them have already come in through the chat box, but I think it helps, and these photos are great, thank you. It helps to talk just briefly also about fat consumption. When we talk about whole food plant-based eating, a lot of times we try to clarify that eating low fat is healthier. And I know that there is certainly evidence out there showing that the more fat you carry on your body, or the dietary fat that you have in your bloodstream, certain fat, actually the fat on your body, can promote hormones that lead to cancer. Can you speak to that specifically as it relates to breast cancer? And
sure. Well, fat is human adipose tissue is a generator of estrogen, right? And we know that for the vast majority of women that they have estrogen-driven breast cancers. That's why we talked about these blocking agents, like tamoxifen is an estrogen blocker because it drives breast cancer cell growth. So we don't want extra fat on us generating this estrogen. The other thing is that you have to remember when you're eating a higher fat diet, what is that fat? What is it? I mean, is it, it is generally saturated fat. You see all those animal foods that I showed you, even the salmon, contain huge amounts of saturated fat. Saturated fat is then converted into bad LDL cholesterol, and then the cholesterol is converted into estrogen. So you want to have a low cholesterol, a low amount of fat intake. High fat diets increase cholesterol.
Mm-hmm.
Here's another thing. We just make people aware of this. We always check in all of our patients oxidized cholesterol levels, damaged LDL cholesterol, because now that is thought to be a major driver of breast cancer. And it gets around estrogen blockade that the oncologist may be given. So when you eat the foods that we showed you are disadvantageous, they raise tremendously the oxidized or damaged LDL. So for all those reasons, it's good to have a low-fat diet.
Mm-hmm. And I bring this up because there were some questions in the chat box about oils in particular, which we as an organization, and I know that you as a practitioner counsel people to keep oil intake low or eliminate it completely. So these things are related, although it's the saturated fat that's more commonly found in the animal foods that seems to be sort of the most villainous character,
Yes,
if you will.
but however, the oils, like if you see oils in processed foods, like if you eat like a blue tortilla chips and they have safflower oil in it or sunflower seed oil, stuff like that, those have linoleic acid in it. Linoleic acid is the beginning of the oxidation of cholesterol. Those kinds of oils cause increased cholesterol levels, which then cause increased estrogens, and then it causes increased oxidized or damaged cholesterol, which has its own mechanism to spur on breast cancer.
Mm-hmm.
Stay away from processed oils.
Gotcha. And as you mentioned, estrogen-related cancers, you had mentioned prostate cancer earlier. I think it's also important to note ovarian cancer being estrogen-related.
Yeah.
Are there others, or mostly those three?
Those are the main. Well, prostate cancer is generally driven by testosterone. Men don't really have much estrogen in them, but it's driven by testosterone. But
Gotcha.
the female cancers are.
Okay. And there was a question that came up much earlier from Phyllis asking, how long do you need to really be eating a whole food plant-based diet for it to fully reduce your risk? Can risk be reduced starting, within X amount of time? Do we know, or
Sure.
is everybody different?
Look at some of those studies I showed you, right? 5 weeks, 6 weeks, right? They did biopsies on the breast tissue and showed, oh my God, within weeks, the aggressiveness of the breast cancer was dropping significantly. Look at, for those of you who don't know my father's story, within 3 months, he was diagnosed. We took him to Sloan Kettering with an end-stage metastatic pancreatic cancer. They gave him 1 to 3 months to live. And 3 months after he started from ground zero, from a plant-based diet, his CAT scan showed a 30% reduction, shrinkage in his major pancreatic tumors. I mean, I've never seen chemo do that. So it works faster than chemo.
Yeah, and related to all the various treatments that are out there for cancers, are there certain foods are all the foods that you mentioned going to help in tandem with other treatments for those who are currently being treated?
Listen, it's not that I'm against conventional medicine all the time. I just like using plants and substituting conventional medicine when they're more powerful. Because we in Ethos Primary Care, we practice evidence-based medicine. I will always advise the patient what to do as long as the evidence shows it's most beneficial for the patient. And it just so happens that the evidence shows that plants almost always are most beneficial. However, look, we have a woman in the practice right now whose aggressiveness scores are very high on her breast cancer tumor. Okay, we know from recent evidence that if she does not get chemo, she will have a 15% increased chance of dying, of not living during the next 5 years after her diagnosis. She's going to get the chemo, and I recommended it. However, she's eating those plants, and I think that if it's necessary for you to get the chemo because it improves your outcome, in combination with the plants do amazing things for the performance status of the cancer patient. It makes them stronger. It makes them heal better from their operations. It makes them tolerate radiation better because plants help your good tissues and shield them from radiation. The plants also, I've noticed in my patients anecdotally, almost none of my patients have severe side effects from chemo, like neuropathy or nausea and vomiting, because they just tend to weather the side effects better.
That's really amazing. And it's just...
And you know, if I just may add this, we do have in vitro data, that means in a petri dish in the laboratory, that if you take breast cancer cells and other kinds of cells like pancreatic cancer cells, and in one dish you just treat it with a chemo agent, and then in another dish you treat it with these plant extracts, we have noticed that in the dish of the cancer cells prepped first with the plant extracts, that there's a significantly increased number of cancer cell deaths than just in the chemo alone treatment dish.
It's fantastic. Thank you so much, Dr. Weiss. I think we should probably wrap up for tonight, but I want to thank everybody for sticking with us. Obviously, having so many of you stay on is a testament to the power of this information. And to whatever extent we can help you take the next step, that's what Plant Powered Metro New York is all about, trying to build community around this new knowledge of what plant foods can do for our health. So Dr. Weiss, thank you very much for bringing your expertise to the table. And of course, we invite all of you who are looking for some support to reach out to Dr. Weiss. And there are a number of plant-based clinicians in our community who are really excellent practitioners to turn to when you need help, especially when you come to the difficult diagnosis of breast cancer and any other cancer for that matter. And before we sign off, I just want to also recognize a number of you made small gifts as you registered for this event. Thank you so much. If any of you are inspired to give a donation to our work, we are on the path to becoming a 501c3 nonprofit and welcome all gifts. Please share the word though about this information with others and direct them to learn more with our community at www.ppmny.org. And we also have Facebook groups and Instagram channel at Plant Powered MNY. So please join us, and thank you so much again for being here. Wishing you all a wonderful evening and much good health as we close out a difficult year and hope to enter a much more promising one. So take care, everyone.
Thank you, Leanna. Thank you, everyone.